Every morning, Travis gets up early and rides his bike to set. But yesterday was no ordinary day. Travis was complaining that his entire world was spinning. It was clear he wasn't himself, so we decided it was best to call a doctor to check him out.
I woke up this morning with severe vertigo, and I'm very blessed because we called Dr. Ted McCracken. He's an ear, nose, and throat doctor with a specialty in neurotology, which means, Dr. McCracken, that you deal with things like vertigo all the time. I already self-diagnosed myself with benign positional vertigo.
Correct.
But I'm struggling. And I gotta tell everyone, I've never had this before. I've taken care of a lot of patients, as have both of you. The world is spinning. In the middle of the night, I turned my head to the left, and all of a sudden, I felt like I was in a ship that was about to go down. I got up, and I fell into the wall. I was like, whoa, this is gonna be a tough day of hosting.
Travis, I'm going to break the news to you. You've always been a dizzy host. What can I just had to tell you that. I think you've self-diagnosed enough. I think it's time now to turn it over to Dr. McCracken.
Please fix me.
All right, so this is the first time you've ever had anything like this?
Ever.
So when it happened last night, how long did it last?
I was in bed, probably 3 a.m., turned my head to the left, lasted about 15 seconds. I was like, ooh, I wonder if that was vertigo. I hope it goes away. I rolled back on my back, came back, about 15, 20 seconds, got up to go to the bathroom, hit the wall, laid back down, and that's when I realized if I turned my head at all, it took a good minute plus for it to normalize, and the world was spinning. And now, all day today, it's like a fog. Right now, it kind of feels almost constant unsteadiness.
So you didn't have during any of this time, your face get paralyzed or your face droop or anything like that?
No.
All right. No.
Smile. It's working.
No recent upper respiratory tract infections, anything like that?
The only thing abnormal, and we were talking about this before, is I did get in a bike accident about 24 hours ago, and then last night I had water in my ear, and I did shake it vigorously.
Like real vigorously.
Real vigorously.
Now, did you hit your head at all with the bike accident?
I don't really remember. No. You know, I didn't have a concussion or anything, but it happened pretty quick. So, you know, it wasn't a big time head.
Now, this can be associated with trauma of hitting your head. In those cases, it can be a little bit more difficult to cure, but hopefully that's not the case, and hopefully it's just a coincidence.
I don't want to be a difficult patient.
So, Dr. McCracken, we have our ear model here. I want you to help us to understand what's going on. Obviously, 3 parts to the ear: outer ear, middle ear, and then finally the inner ear. It's this inner ear, and you ask questions about hearing because the inner ear, this part that looks like a snail, is involved with hearing. You see the nerve, and then these rings that are in 3-dimensional are involved with balance and vertigo.
Correct. It sounds like what's going on. The posterior canal is the most common affected canal with this. And what happens is these little crystals that are in this portion of the inner ear, they get dislodged into the posterior semicircular canal, these canals here. And really, they kind of just set the body off and think your head's moving when it's really not, just based on gravity alone. So when you turn your head to the side, these crystals move. And when these crystals move, they, again, make you think that your head's moving in space when it's really not. And they kind of causes the vertigo.
And I want to say really quickly, because I know you're going to potentially perform what's known as these Epley maneuvers on me. This is what you do. And I want to, anyone out there who's suffering with severe vertigo, look, benign vertigo like I have, most doctors can treat you. But luckily, you've already diagnosed it. I'm pretty sure this is a benign paroxysmal positional vertigo. But other things, vertigo that won't go away, that comes on more slowly, I mean, it could be things like tumors. There are other serious causes, and luckily we have neurotologists like you who can help really figure out what's going on. So now that we have the diagnosis, I gotta tell you, I'm pretty anxious and praying. So I remember learning the Epley maneuvers in school, have used them on others, but I never thought I'd need them on myself. So can we?
Okay, so since your symptoms are most on your left, we're going to do your right side first to make sure that that side is normal. So what I'm going to do is I'm going to turn your head to your right side, keep your eyes open, that's all you have to do, and try not to focus on anything, just kind of look blankly into space. We often will have kind of these goggles we'll use, we don't have them today, but we have these goggles that kind of blur your vision so you can't really focus on anything. So I'm going to turn your head to the side, and I'm going to lean you back. Okay, just keep your eyes open. So what I'm looking at right now is really the eye movement to see if the eyes are rotating, and they're not. Okay, so we'll sit you back up.
So-called nystagmus, right?
Correct.
Which you did
okay?
not. You all right? But you felt that.
Oh, yeah.
Yeah.
I could see it.
All right, now we'll do the other side. All right, now turn your head and lean you back. Very fast. All right, now just keep your eyes open. You feel dizzy? Uh-huh. So what I'm looking at right now, his eyes are really rotating.
I can see it. They are.
And his eye movements are kind of the classic. As we go to the other side, you'll likely have it again, okay? So you stay here for about 45 seconds to 1 minute. And since it's positive on this side, we'll go ahead and do the maneuver. So what I'm gonna do is I'm gonna rotate your head 180 degrees in the other direction, okay?
Okay.
1, 2, 3. All right.
How's that feel?
Better than the other side.
And often, tapping on the back of the head on the mastoid bone can kind of get those crystals moving a little bit better. All right, now keeping the head turned where it is, I want you to put this shoulder up, this shoulder down, and lie on your side, okay? All right, and keep your head down, relax down, okay? In this position, it allows gravity to do the job. It takes those little crystals and moves them through that canal, just using gravity alone to kind of sink
Like you said,
as you
it's all
move.
about those little crystals that have moved to the wrong place.
Now we'll just have you sit up, just swing your legs around to the side of the bed, keeping your head where it is. Just move your knees to the side.
And I'm gonna sit up.
Yep, now I'm just gonna move these
To the
off.
to the side.
Yep, and then just sit straight up. So the symptoms from this can last, can you feel a little bit of disequilibrium, not true vertigo, but kind of feel off kilter for, really some people describe it for a few days. Most people, within a day, it'll kind of resolve.
So does that mean that anything I say cannot be held against me during the rest of the show?
We're not going to have you do any jumping jacks today. You sort of knew what was going on, but for people that don't have the inside knowledge, it could be a very scary thing.
Absolutely.
Well, it's, you know what it is? It's jarring. And if you're just walking down the street and all of a sudden you have no balance and you feel like you're on a ship and the world is spinning, that's vertigo. And that's why one of the first things we always ask in medicine, are you lightheaded, dizzy, or do you feel like the world is spinning? Because vertigo is very different than being lightheaded. Lightheaded is when you stand up and you feel like you're gonna pass out. Vertigo, which I now understand it, the whole world is spinning, you move, and everything is off kilter. So just understand that usually that's an inner ear issue. And these maneuvers, I got to tell you, I'm crossing my fingers. I'm gonna pray that within 24 hours I'm okay, because otherwise, Drew, you may be sitting in my chair.
Okay.